Have you reached the big 40 and are wondering what your birth control options are? And if you haven't been thinking about it, well, you should, because your age can affect the birth control method that you choose. And not just age, a few other issues that we're going to look at in this video. Hi there, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Welcome to our channel. We provide health information videos that teach you about your body and help you live better. So please like this video and subscribe to the channel. Don't forget to click the notification bell so that you get alerts when our new videos come out once a week. Yes, what you choose for birth control in your 20s could be different from what you choose in your 40s. It might not affect everyone, but if it does, then it has something to do with the method's safety profile as we grow older. The critical difference between the 20s and 40s is, of course, as we grow older, more medical conditions are likely to happen. And the birth control methods that are particularly affected are those that contain the hormones estrogen and progesterone. So now let's look at this in a little more detail and end with the safest options for birth control when you are 40 and above. As we grow older, we're more likely to develop certain medical conditions, for example, high blood pressure, high cholesterol, or type 2 diabetes. In addition, we may become less physically active, especially if we're quite busy and trying to juggle both work and family or home life. Another big factor for us ladies is that this is the time that we start to enter the perimenopause, a unique phase in our lives transiting to the end of the reproductive cycle. All these factors can happen after the age of 40, affecting the safe use of birth control methods. So I'd like to talk you through 4 key issues that affect your birth control choice. 1. Heart disease. The risk of heart disease starts to go up after the age of 40. In addition, studies indicate that taking the combined pill leads to a slightly higher risk of developing blood clots in your veins, leading to the conditions deep vein thrombosis, DVT, or pulmonary embolism (PE) than someone who's not using the pill. But it's important to say that during or just after your pregnancy, you are at a much higher risk of developing a blood clot than someone who's using the combined pill. But going back to the age effect on heart disease, did you know that the risk of DVT increases from 1 in 10,000 women around the age of 40 to 1 in 1,000 for women around 60 years old? Growing older also increases our risks of developing blood clots in our arteries, which can lead to problems like heart attacks or strokes. The next factor that is relevant to our birth control method choice is cancer. The risk of womb, breast and ovarian cancer increases as we age. Even for ladies in their very early 40s, conditions like polycystic ovarian syndrome or being obese also can make womb cancer more likely. And number 3, thinning bones. Over the age of 40, you're more likely to have thinning bones than a woman who is younger because of the dropping estrogen levels as we head towards the menopause. In addition, women around and over the age of 40 also experience a rapid loss of their bone mass. These are the reasons why women are more susceptible to experiencing bone fractures as we grow older. And this is related to the 4th factor, which is menopause and hormone treatments. Contraception is still important in perimenopause when pregnancy is still possible, and many women can get uncomfortable symptoms that require some treatment. Using HRT, that is hormone replacement therapy, or non-HRT drugs can affect the type of birth control method that you choose. So now that we know the key issues that affect us as we grow older, let's look at each of these specific methods and see how they measure up for women 40 and above. First is the copper IUD. The copper coil is a very effective contraceptive method. Women from the age of 40 can use the copper IUD until they reach their menopause. The main issue to watch out for is that the copper coil can cause heavy and irregular bleeding in some users. So if at this age a woman is already experiencing problems with irregular periods and heavy periods, as can sometimes happen, then the copper coil would not be appropriate for her. In the UK, copper coils are licensed for use over 5 years or 10 years. One benefit of using the copper coil after the age of 40 is extended use. If you have your copper coil placed by age 40, You can leave it until 1 year after your final menstrual period if this happens by the age of 50 and over. If your final menstrual period happens before the age of 50, you can leave the coil for another 2 years, and that saves you having to change the method early. Second is the combined hormone method, so that is the combined pill or combined ring or combined patch. If you've not watched my video on the combination patch birth control method, check out this video here. The combined methods contain a mixture of 2 human-made hormones, estrogen and progesterone. The patch and the ring contain similar hormones to the pill, so we believe they share similar effects. For a lady who's able to use the combined pill after the age of 40, the older traditional methods which contain levonorgestrel or norepinephrine with less than 30 micrograms of ethinyl estradiol are preferred. A woman is 15 times at greater risk of developing a blood clot during her pregnancy or within the first 6 weeks after she's had her baby compared to the traditional combined pill methods with levonorgestrel or norepinephrine. The risk of developing a blood clot is higher with the combined patch or combined ring compared to the combined pill containing levonorgestrel or norepinephrine. The newer pill methods, for example those that contain desogestrel, have a higher risk compared to the older pill methods, although still much less than during pregnancy. Over the age of 50, we advise women to switch to an alternative, safer method due to the risks of strokes, blood clots or heart attacks. There is also a small increased risk of breast and cervical cancer when taking the combined hormone pill. However, this risk disappears by 10 years after stopping the pill. If a woman over the age of 40 is suitable to use the combined pill method, there are some non-contraception benefits. It can help in reducing period pain and bleeding. It can contribute towards a reduced risk of ovarian and womb cancer, and this lasts for several years after stopping the pill. It can also help these women to maintain their bone health around the menopause. However, despite these benefits, the combined hormone methods will not be recommended if you are over the age of 40 and are overweight, have high blood pressure or other risks for heart disease. We also advise women who smoke to stop a combined method at the age of 35 because this is the age at which the risk of dying from smoking related problems begins. Third, let's look at the progesterone intrauterine system. The progesterone containing coil is currently available in the UK as Mirena, Kyleena, Jadis and Levocert. All of them are licensed for birth control. Only Mirena and Levocert can also be used to treat heavy periods. Using the progesterone coil also comes with some non-birth control benefits. One of them is protecting the users from womb and ovarian cancer. Mirena in particular is used in protecting the womb of women who are taking estrogen-only HRT, and some of the progesterone coils help with problem bleeding for women over the age of 40 and are actually thought to be more effective than the combined pill or other non-hormone drugs used to treat this type of bleeding. When you look at the risk issues that we discussed earlier, there appears to be very little or even no increased risk of stroke, heart attack or blood clots using the progesterone coil. The breast cancer risk is also lower with this method, and so if a woman is eligible to use the method after the age of 40, she's encouraged to continue regular self-breast examinations. Women using this type of coil after the age of 40 can also enjoy the benefits of extended use, but this can depend on the age when it was placed and whether or not you still have periods, so please check with your doctor. Fourth, let's talk about the progesterone implant. The implant is among the most effective forms of contraception and it has no age restriction. It is not linked with an additional risk of blood clots, thinning bones, heart attacks or strokes. You may experience irregular bleeding from using this method, but this is not so different from the experience that younger women do have. Women who choose to use the implant can continue to do so until the age of 50 and beyond, even up to the age of 55, when most women are assumed to have lost fertility. And fifth, let's talk about the Depo shot or progesterone only injection. I have a couple of videos on this method on the channel. Have a look here and I'll place the links for you in the description box below. One of the critical issues around using the Depo shot after the age of 40 is your bone health. Over the age of 40 and in the absence of any other health problems, you can use the Depo shot, but you do need to have regular reviews so that your health provider can check that the benefits you're getting from using that method are much higher than any risks. By the age of 50 though, we will recommend that you switch to another method to avoid the increased chance of thinning bones and possible fractures. It's important that if after the age of 40 you also have other risks of thinning bones, examples are smoking, low physical activity, a family history of thinning bones, or low vitamin D levels, you should use an alternative birth control method. There is no direct link between Depo shot and blood clots, and possibly only a very small risk of breast cancer, which goes away after you stop having the injections. So we recommend switching to an alternative method after the age of 50 if you're on the Depo shot, but regular checks with your health provider are always important regardless of your age. Next, at number 6 comes the progesterone only pill or mini pill. The POP or mini pill contains just human-made progesterone. It is not linked with an increased risk of blood clots or heart attacks, strokes, or an effect on your bone health. And according to studies, the mini pill does not have an obvious or significant increased risk on breast cancer. And in some women, it can provide some benefits that are not related to birth control, like helping with painful periods or endometriosis. And so if you wish to continue with this method after the age of 40, it is acceptable as long as you don't have any other health problems that could make it unsafe for you. And if that's the case, you can continue with the mini pill after the menopause and into your mid-50s. The mini pill can cause irregular bleeding in women of any age. So here's a reminder, please see your doctor for any changes in your bleeding pattern while you're on the pill, particularly after the age of 40 or 45. Next, we're looking at female sterilization at number 7. If you're over 40 and you're considering surgery to tie your tubes for the purpose of birth control, maybe consider other methods like the implant or coil or vasectomy. The argument is over the age of 40, you're only a few years away from natural sterility. So is it worth it to take the risks of surgery to tie your tubes? Number 8, barrier methods. For example, the male or female condom, the diaphragm or cervical caps and so on. These have no age restrictions. They may even be more effective in women over 40 because fertility is declining naturally. And at this age, you're probably more likely to use them more consistently than younger people, improving their effectiveness. Number 9, natural family planning methods also have no age restrictions. However, please remember that this method can become unreliable as your menstrual cycle becomes irregular towards the menopause. As a result, interpreting your safe days and cervical secretions can be challenging. Number 10, withdrawal. Many more women than we realize use the withdrawal method after the age of 40. It relies on your partner for its effectiveness, and if you want to learn my thoughts on this method, please check out my videos here. So it is not a reliable method at any age, including over the age of 40. Plus, it does not protect you from sexually transmitted infections. Number 11, emergency contraception. Over the age of 40 and before you become menopausal, you can still fall pregnant. This is because you are still ovulating until you reach menopause, and the highest risk is on or around the day of ovulation. But over 40, you've got options. You can use the copper coil, the emergency birth control pills like Plan B, Postinor, Postinor 2, or Ella, and please check out my videos on all these different methods to learn more about them. To recap, if you are over 40 and have no health conditions that prevent you from using them, you can use the copper coil, progesterone coil, the implant till you reach menopause. You can also use methods like the Depo shot after 40, but from 50 years, we will recommend you switch to a safer alternative. Lastly, the combined hormone methods present significant risks after the age of 40, especially if there are other issues like being overweight, having high blood pressure and smoking, and so we would recommend in any of these scenarios that you switch to a safer method. I hope this gives an excellent overview of how your age affects different birth control methods. Please let me know in the comment section below. If you've got any questions on this topic, reach out to me using our email health service. We send prompt responses straight into your mailbox. Next time I'm going to be talking about the combination birth control patch in a lot of detail. So please make sure you like this video, subscribe to the channel, and click the notification bell to get alerts every time we have a new video published. Check out these two while you're waiting for the next video, and I'll see you again soon.